I'm Professor Leslie Fallowfield. I'm Professor of Psycho-Oncology and the Director of SUREC. SUREC stands for Sussex Health Outcomes Research and Education in Cancer. And what I'm going to do is tell you a little bit more about how we are managing your assessment in the POSNOC trial. So I mentioned that the research that SUREC is involved with includes looking at the assessment of outcomes in big clinical trials of cancer treatment like POSNOC. And I'm going to tell you a little bit more about what we're doing with your questionnaires that you fill in a moment. But first of all, the other important role that we have is education. That's helping healthcare professionals learn how to communicate about complex things, and also helping patients understand more about the sorts of treatments they might be having and the clinical trials that they're being invited to join in. So some of you might have actually seen this DVD, the POSNOC DVD that we made prior to you consenting to join the study. So I'm going to tell you now a little bit more about the quality of life assessment that you've been kindly doing for us. So it's really important that we evaluate not just within a trial which treatment or which procedure might improve survival, reduce recurrence, but also the impact that the different things have on your overall quality of life. So we've been sending you out questionnaires. The most important one is the FACT-B+4. This is a widely available questionnaire that's been used throughout the world in thousands of patients involved in different breast cancer studies. And it looks at your physical, functional, social and emotional well-being. But the important thing about the +4 bit of the questionnaire is we're also looking at how well your arm movements are on the affected side post-treatment. The other questionnaire that we're giving you is something called the STI. That's looking at your overall sort of mental well-being, I guess, mental health during treatment in the trial. So all of these questionnaires provide the study designers with a very accurate view, not just of how well the different treatments work in managing your cancer, but also the impact on your well-being. So hundreds of questionnaires come back into SUREC every week. And the first thing that needs to happen is they all get checked and date stamped. So one of the things that we take very, very seriously is the confidentiality of your data. And it's all got to be, all those questionnaire answers that you give us, they've all got to be entered into a computer for the statisticians to analyse at the end of the study. And here is the sort of work engine of ensuring confidentiality, protection of your data. This is Shirley, who's our Senior Systems Analyst, who makes sure that all the questionnaire data, all the answers are stored properly in programs that can be sent safely to the statisticians for analysis. Nearly 2,000 women are involved in the POSNOC trial, and that is a big study requiring some really, really first-class data management. So here we have our Senior Trial Coordinator, Catherine Monson, who's going to tell you a bit more about all the processes involved once we get those questionnaires out and back in.
I've worked on the POSNOC study since it started. When your questionnaires arrive at SUREC, first of all I check them for any queries, and then I enter the data onto our secure database. Next, I hand the questionnaires to one of my colleagues who checks that all the data have been entered correctly. Then we file your questionnaires in our secure filing system, which holds all of our research data. This ensures that your data are ready for the statisticians to analyse at the end of the study.